Senator Greg Tarver. Hey, Mr. Greg, how are you this morning? Thank you for taking time for us.
Fine. How you all doing?
Good.
Well, there's a rather, I would say, serious accusation. I'm sure one that you did not make lightly. And let's start with that because that's the big boy charge. Medicaid fraud? Why do you think that? What evidence do you have? What made you say that?
Well, let me tell you the reason why. Number one, they're placing things in the cost report. That's the report is filed every month or every quarter, and that is unallowables. Give you an example. They have placed last year $1.3 million, approximately that, and $892,000 in the cost report. That's $2.3 million that they're taking out of the safety net of University Hospital that is supposed to be used to serve people. They're paying lawyers.
Legally, does that constitute fraud? Obviously, it does in your mind.
Let me tell you the reason why. When you know it's not cost allowable and you put it in there, yes, it is. At the same time, there are people that working for University Health doing work for BRF. That is another problem that we have. Number three is that they have two companies. One is named Future State LLC. The other one is named Future State Technology. One is owned by Biomed. The other is owned by someone else who worked for University Health, and people own that company, still work for University Health or BRF, and they collected last year. They collected $6 million. That is appearance of that's a conflict of interest, or the appearance of double dipping. I just want the Attorney General to go in and clear all this up. I've been hearing rumors all year about how they are doing things up there. I want the Attorney General to go in there and clear it up and make sure there's no such thing as a fraud up there.
The governor was here yesterday. I'm sure you were with him. What did he hear? What did he learn? And where are we in terms of renegotiating a new deal for BRF or getting someone else?
Well, let me say this to you. The governor told them he wants them to clear up. They've been having an MOU, a quality study. They've been dealing with this since October last year, trying to get a contract signed to do a quality study. The reason they need to do that quality study is because University Health received 1 star for CMS. CMS is the people that fund Medicare. Leapfrog gave them an F. All the rating agencies that rate hospitals rate University Health below. That is why, number one, they need the quality study. It's in the MOU. Number two is that they don't want them to do the quality study because they have to look at their books. They don't want they don't want anyone looking at their books. What they got to hide. They should not have anything to hide. Once you pay lawyers $2.3 million a year of the people money that is supposed to be used to serve people, something wrong with that.
Let me ask you this. There are also charges that the care at University Health, you have concerns about that.
Well, let me tell you what I'm saying about care. They own a lot of suppliers. They do not get the supplies that they need to serve people to deliver good health care services. People are still waiting 6 and 7 hours up there for medical care. I'm saying that how can you give top-notch service and you're not paying your suppliers? Now, they're not only paying their suppliers. You know when they paid LSU? They paid LSU yesterday at $4.45. One of the officials of BRF said they paid them earlier. The lady from the CFO for LSU Hospital said, I have not received a check. And that was yesterday at 2 o'clock. At 3 o'clock, she did not receive a check. They came in at 4:45, but they say they paid them earlier, but they did not. Somebody is lying somewhere.
You want the medical school back in charge of University Health. What would that change? What would happen?
Well, let me say this to you. The reason I want LSU Med School to control the health, the University Health, the hospital up there, because it would be better run and will be most cost effective. When they were together, the school received $30 million a year from the hospital. They always had money or profit. They sent the profit to Baton Rouge. Every year they had a profit. They wasn't asking the state for money. They wasn't doing anything. Only time they start asking the state for money is when University Health took over. You cannot run. They have a high level of employees up there. It's not the employees that work every day at University Health that's the problem. It's the administration that's the problem. They have ran through CFOs, 3 or 4 of them.
Biggest flaw with BRF as you see it?
They do not have the money to operate their hospital and pay LSU for their services. Let me tell you, it's a threat. When they don't pay LSU for their service, that means LSU cannot pay other people. What is happening, if University Health continue what they're doing now, if they continue it, they are going to destroy LSU Med School.